The Speaker of the House, Paul Ryan. Mr. Speaker, thank you for joining us this morning. A lot to talk about here this morning. Just want to start out with a big bottom line question. You just heard Dr. Gawande there. He said that this is going to make health care worse off on almost every level. Can you guarantee, based if the House bill were to become law, that no Americans would be worse off than they are today?
I fundamentally disagree with this analysis on so many levels, George. But first of all, good morning. It's good to be with you. Second of all, let's remember what's happening right now. Obamacare is collapsing. Obamacare isn't working. What good is Obamacare for anybody, let alone a person with pre-existing conditions, if you don't have a health insurance plan that you can even get? So this is a rescue mission to make sure that we can achieve the goals we all want, which is getting the cost of coverage down and making sure that everyone has access to affordable health care, especially and including people with pre-existing conditions. That is what our bill does. Well, let me just say a couple things. You've got all these health insurers. If they were doing so well, why would they be pulling out of the marketplace? Over 1,000 counties, 1 in 3 counties in America, have one plan to choose from. Just this week in Iowa, their last statewide insurer said that they are going to have to pull out. So that means people in 94 of Iowa's 99 counties will have 0 choices. Aetna just pulled out of Virginia. The law is collapsing. It's not working. You can't get health insurance in these places, whether you have a pre-existing condition or not. And so what we're trying to do here, George, is step in the front of this collapsing law and make sure that we can have a system that works, a system with choice and competition and affordable premiums. And we have multiple layers of protections for people with pre-existing conditions.
Well, let's talk about that first.
So they, too, can have the peace of mind. So they, too, can have the peace of mind to get affordable coverage.
Let's talk about that first, because under the amendments that you had, states will now have the option, if they choose, to allow insurers to charge people with pre-existing conditions more. And you heard Dr. Gawande and others say that in the states where there have been high-risk pools, they've generally been underfunded. And even if you'd used all $138 billion that you all put in for high-risk pools, that would still cover only a fraction of those with pre-existing conditions.
Yeah. Can I get you there for a second, Dan? So under this bill, no matter what, you cannot be denied coverage if you have a pre-existing condition. Under this bill, you cannot only not be denied coverage, you can't be charged higher. Let me finish my point. You can't charge people more if they keep continuous coverage. The key of having a continuous coverage provision is to make sure that people stay covered and they move from one plan to the next if they want to. It's kind of like waiting until your house is on fire to then buy your homeowner's insurance. You want to make sure that people stay covered to keep the cost down.
But as you know, Mr. Speaker, sometimes people lose coverage through no fault of their own. No, that is one point. I just want to get in on that point.
So let me finish my point. That's right. So I was getting there until you just cut me off. The point of this bill, in those states that get a waiver to do what they need to do to make it work better in their particular states, has support exactly for that very person who, if in the course between a year, get extra aid for support for pre-existing conditions. And on the state waivers are on the condition that a state has a working high-risk pool to help specifically that person with a pre-existing condition. Let me give you one example. In Wisconsin, we had a really successful high-risk pool. 10% of the people in the individual market in Wisconsin were in the state high-risk pool. They had 8 or 9 plans to choose from. They could go to any doctor in any hospital they wanted, and their premiums and copays were cheaper than they were under Obamacare today. And the other 90% of Wisconsinites in the individual market had better health insurance, cheaper health insurance, more choices. That is what we want to get to. And you can't say for healthcare in America, one size fits all, one rule for the entire country. Our states are different. In Maine, they had an invisible risk insurance program, which is the model we use for this bill. And that said that you didn't get a different healthcare plan. It's just if you became catastrophically ill, subsidies kicked in and supported your health insurance and your premiums so that you didn't have premium shock. And what that did is it lowered the cost of premiums for everybody. Because if a person gets a catastrophic illness and state and federal subsidies kick in to support that person, it means all the other insurance plans don't have to cover those eventual costs, and you stabilize that marketplace. That is the approach we're having here, because our goal is this, George. Get everyone access to affordable care, including people with pre-existing conditions, and that is not happening under Obamacare. Obamacare, the premiums are going up double digits, the deductibles are sky high, and choices are evaporating to the point where 1 in 3 counties in America have one insurer left, and now we're learning those last insurers in many states are pulling out. So this is a crisis. We're trying to prevent this crisis, and we think we have better ideas. And by the way, in Wisconsin, we had a good system. In Maine, they had a good system. Let the states, because states are different from one another, let the states perfect this while making sure we have multiple layers of protections for people with pre-existing conditions. We're proud of this. We're proud of this effort. It's us keeping our promises, and it's much better policy than what we're seeing with Obamacare.
There's a lot of uncertainty over what exactly it will do, including in the Senate. Senator Lindsey Graham, right after had a tweet saying a bill finalized yesterday has not been scored, amendments not allowed, and 3 hours of final debate should be viewed with caution. And I want to go back to something you said in 2009 when Obamacare was being debated. Here you were on MSNBC.
I don't think we should pass bills that we haven't read, that we don't know what they cost. If you rush this thing through before anybody even knows what it is, that's not good democracy.
A lot of your members have conceded they didn't read the bill. There wasn't a single committee hearing or committee markup on the finalized version of the bill. There wasn't a CBO analysis of this bill. So have you met your own standard here?
Yeah, I think this is kind of a bogus attack from the left. Let me say a couple of things. The bill's been online for 2 months. The bill has been
not
in
the
its current
final
form
version
online for a long time. The final version was an amendment that was 3 pages long. It takes you 30 seconds to read. By the way, Obamacare was over 2,000 pages. This bill is under 200 pages. It doesn't take long to go through this bill. And the final amendment, 3 pages long. But more importantly, we got 2 CBO scores. And the most recent CBO score showed that we're perfectly in compliance with the Senate budget rules, which is what matters here. And this last amendment, a 3-page amendment, is not going to dramatically alter that score. It was narrow changes to the bill that has been online for quite some time.
Well, in fact, the members who voted for it, the members who changed their votes, said they were quite significant changes to the bill. It changed the essential benefits. It changed how you dealt with pre-existing conditions. It added money as well.
The last one was, it's called the Upton Long, and several other members wanted this amendment. We looked at the whole country, and we wanted to see, is there a situation, under any situation, with the state getting a waiver, if there's a person that could get charged higher health care costs because of their health status, because of a pre-existing condition? We looked and decided there might be a situation where within the course of 1 year, a person could conceivably get higher health care costs. This amendment affects that. So we have all these multiple layers of protection to make sure that these families, that these people, look, these are our friends and our constituents. We want to make sure that people who have bad healthcare status, who have a pre-existing condition, get affordable coverage. And that's not happening in Obamacare. You got to remember, if you can't even get a health insurance plan, what good is it? You don't have health insurance. So what we're trying to do here is have a system where we have more choices, more competition, and lower prices. And yes, this CBO score does say it lowers premiums. The goal here is 2 things. Get premiums down, and give people choices, and make sure that people with pre-existing conditions get coverage, and we have multiple layers of this.
The CBO,
but a one-size-fits-all federal government-run system does not do that.
The CBO analysis also says a lot of other things. It says that over 10 years, 24 million people will lose their coverage. It says for most Americans, deductibles will go up. It says that for a lot of Americans who are in that age range just short of Medicare, 55 to 64 years old, particularly in rural areas, they're going to be paying thousands of dollars more in premiums every single year. The AARP calls that an age tax. So if you accept one part of the CBO analysis, do you accept that other part of the CBO analysis as well?
Yeah, so the first point, the 24 million statistic, what the CBO is basically saying, and I agree with, is if the government's not going to force somebody to buy something they don't want to buy, then they're not going to buy it. So they're basically saying people through their own free choice, if they're not mandated to buy something that's unaffordable, they're not going to do it. So under this bill, everybody's going to get a refundable tax credit to buy a plan of their choosing. But on the age point, I think you make a good point, which is what Obamacare tried to do is it said, we're going to have young, healthy people subsidize older, sicker people. That didn't happen. Those young, healthy people just said, I'm not paying for this unaffordable insurance. I'll pay the penalty. And that's one of the biggest reasons why Obamacare is collapsing and insurers are losing money and pulling out of the marketplace. So we're fixing that, and we're also adding money. This was one of the more recent amendments, but it's been out there for a month, which is we're going to add more money to the tax credit for those people you just mentioned, the people who are 50 and 60 years old. Then that's what the Senate's going to do. So that's what Lindsey Graham, I think, is talking about, which is we added money to this bill, which the Senate will complete the job of making sure that the tax credits for those people who are in the older cohorts, 50s and 60s, will have a much larger tax credit to reflect those changes. The fact that their health care costs more, because what we learned with Obamacare is making younger people buy unaffordable insurance that they can't afford. They're not going to do it.
It sounds like
that is one of the reasons why Obamacare is collapsing.
It sounds like from what you're saying there is that you wouldn't be comfortable with this bill being signed into law.
No, this bill takes $85 billion and adds it to those tax credits. What the Senate's going to do is the specific adding to the tax credits. The Senate's going to say, let's figure out exactly how much more of a tax credit a 50-year-old gets and how much more a 60-year-old gets. So what the House bill did is it took this bill and said, we need to add more money to those refundable, advanceable tax credits for the older people, and the Senate is going to complete the job of saying just how much more money. And so this is one stage in a multi-stage legislative process. You know how this works. You pass a bill through the House, and you pass a bill through the Senate, and then you go to conference and iron out the differences. And we've already acknowledged we think we need to do even more support for people who are older and also more support for people with pre-existing conditions, but give states the ability to kind of craft and customize health insurance to meet their unique health insurance markets. Look, I got to tell you, I know the Wisconsin health insurance market really well. It's a lot different than the New York health insurance market or the Texas health insurance market. But we have this one-size-fits-all rule from Obamacare that is crashing. It's why insurers are pulling out, people are getting no choices, and premiums are skyrocketing. Premiums went up 116% in Arizona this year alone. So it's not working. We need to fix this problem for the sake of just our constituents, of the American people. People want the peace of mind of knowing they can get affordable coverage, especially for people with pre-existing conditions. And quite frankly, George, that's what we're achieving.
And a lot of people think it's going to be worse. I want to get to another point, though. This bill does cut taxes by about $900 billion. It cuts Medicaid and other subsidies by about $1 trillion. I want to put up a chart right now that shows the distribution of those benefits and burdens right there. And it shows that just about everybody under $50,000 is going to be cut back. Small benefits for the middle class above that, but a huge, huge benefit for those making over $200,000 a year. Warren Buffett just yesterday said he's going to get a 17% tax cut. And your critics are saying this is just a huge transfer of wealth from the poor and the middle class to the wealthy. How do you respond?
A couple things. We're keeping our word, which is we're repealing and replacing the entirety of this law, which is we're repealing all the Obamacare taxes. The Obamacare taxes are job-killing taxes that hurt economic growth and, more importantly, make health insurance more expensive. These taxes, and most of them, are aimed at the healthcare system, which actually makes those premiums higher. It pushes medical device companies overseas. It makes it more expensive for you to buy your health care. That's point number one. Point number two.
Most of the benefits go to millionaires.
Medicaid. We're repealing all of the Obamacare taxes. But the Medicaid, what we're doing with Medicaid, we're giving the states the ability to customize Medicaid to meet the particular needs of their vulnerable populations. You got to remember, Medicaid is a program that is administered by the states but micromanaged by the federal government, and not very well. More and more doctors are refusing to even accept people with Medicaid. And so we want to give the states the ability to customize the Medicaid program to work for their particular states.
But you're saying they can do that with $880 billion less. You're saying they can do that with $880 billion less.
We're giving states the ability to run their own Medicaid program, and it is increasing per medical inflation. And by the way, we recognize that for certain people in Medicaid, the disabled, the aged, people in nursing homes, we're giving them an even bigger increase so that their funds are even more than everybody else. And so by giving states the right to run Medicaid and giving them a block grant, per capita block grant or a block grant, and then increasing that spending by medical inflation, I hardly think that's draconian.
So you don't think anyone's going to be hurt when you're taking $880 billion out of the system?
No, I don't, because I think the micromanagement of Medicaid by the federal government, the Medicaid system isn't working. Doctors aren't taking Medicaid. Hospitals can't survive with Medicaid alone. So by getting the states the ability to customize their Medicaid population, their program to work for them, whenever we've had a waiver given to a state so they can customize it works better. So we want to give every state the ability to make sure that they can customize this program to work for the unique needs of their vulnerable populations. Again, George, here's the fatal conceit of Obamacare. It says we're going to micromanage this with bureaucrats in Washington telling every state and every community how it must work. That is failing. Medicaid isn't working. Obamacare is collapsing. Insurance plans are pulling out. People are getting no choices, if any at all.
Yes.
And we have to fix this. This is a rescue operation, and you have to acknowledge every state is a little different. And so what we're trying to achieve here, and what this bill does achieve, give states the ability to meet the needs of their populations, but put the resources in there so that everyone can have affordable health insurance coverage,
you talk about the state,
including people with pre-existing conditions.
You talk about
micromanaging this from Washington, we've already shown that this isn't working.
You're talking about the state flexibility. Senator Susan Collins is coming up next. She has a bill with Senator Bill Cassidy that says basically if a state wants to keep Obamacare, they can. If a state wants to experiment, they can. That's state flexibility. What about that bill?
Well, I think Susan Collins has made a tremendous contribution to this debate. Again, we want to make sure that we get rid of these Obamacare rules, these regulations, these taxes that are making it impossible for insurers to survive, for plans to be offered. And we want to give the states this kind of thing. So if Maine, by the way, she comes from a great state which has an invisible risk insurance system, which says that we're gonna pay for the catastrophic illnesses for people who are catastrophically ill. And what that has done in Maine is it lowered the premiums for people with pre-existing conditions, and it lowered the premiums for everybody else because we target the support for those people who have a pre-existing condition. That is the model that we're copying in this bill. We think, look, 1% of the people in the individual market drive 23% of the costs in health care in the individual market. 5% drive up almost 50% of the costs. So what we're saying is let's target our support for that population so that they get the peace of mind and get lower health insurance costs, and that stabilizes the market for everybody else. Maine has proven how this can work successfully. And so we're looking at that Maine model, and we're saying let's do that nationwide. And then if a state like Wisconsin wants to do something slightly different because Wisconsin's different and unique, let them do that, so long as we maintain coverage for people with pre-existing conditions and give everyone equal access to health care. You can't be denied coverage if you have a pre-existing condition.
But it doesn't sound like
these are important rules we think that are going to be maintained. And the goal here, I'll just say it one more time, lower prices, expand access and coverage.
It doesn't sound like a full endorsement, Senator Collins, but one final question. We're just about out of time. I want to ask you a question on the politics. As you know, the Democrats got wiped out in 2010 after voting on Obamacare. It's one of the reasons you're Speaker today over time. They smell real blood now. You saw Leader Pelosi. And on Friday, the Cook Political Report, well-respected, shifted 20 seats away from the GOP. Here's what their analyst Dave Wasserman said. He said, House Republicans' willingness to spend political capital on a proposal that garnered the support of just 17% of the public in a March Quinnipiac poll is consistent with past scenarios that have generated a midterm wave. How worried are you about a midterm wave? What are you telling your members?
I'm not. Number one, healthcare is a complicated and very emotional and personal issue, and we completely understand that. The system's failing. We're stepping in front of it and rescuing people from a collapsing system. And more importantly, we're keeping our word. That's really important here, George. People expect their elected leaders, if they run and campaign on doing something, they expect them to do that, and that's what we're doing. We're keeping our word. And I would argue that we would spell disaster for ourselves politically, if that's your question, if we go back on our word. This is us keeping our word, but most importantly, it's us trying to fix a real problem that real people are experiencing in this country.
Mr. Speaker, thanks for your time this morning.
Thank you, George.